been in existence for 40 years. We do such things as provide rental and utility assistance, food pantry, and we provide a prescription medicine program. Basically, three thoughts in my head. The first is this need for additional access to primary care physicians and the potential expansion of such clinics as Cottage Grove, which would be wonderful for our population. The partnership with FQHCs, that could be very well and good. I know at this point, we look at Aunt Martha's in Chicago Heights, meeting with the building manager there last week, she reports 4-hour waits to see a doctor, which is horrible. Nobody should put up with that. I know that the Access Dental Clinic down the street from us sends their patients to get the $55 copay. We're a little $500,000 a year operation. They want $55 from us so that these guys can get dental health services. So, FQHCs might have something good to do, but there's obviously a lot of gaps that need to be filled as far as that goes. Regarding inpatient services, I can't fathom where these people would go. When people are in need of 10 to 12 days of hospitalization or surgery or monitoring, they can't go to St. James in Chicago Heights. They can't go to Ingalls. It's unconscionable to imagine sending these people to Stroger Hospital out of their community, away from family, from Sauk Village, Park Forest, Chicago Heights. There'll be no place for these people to go to get patient care unless they have insurance. And we see it all the time. We see clients who come in who have just been discharged after a couple of days for some chronic ailment, some need. People who haven't been admitted at all.
You have 1 minute.
So this is a very serious problem. We see this. Another thing that we see, another thing that we really value Oak Forest for is the use of filling prescription medications. Client comes to respond now, they have prescriptions from Aunt Martha's, from Access, the FQHCs. They have a prescription from St. James, Ingalls. They come to us because they can't fill these prescriptions. And we do that because that's what we do. We fill their asthma medications, their antibiotics as a matter of course. We'll fill their chronic meds, diabetes, heart condition. But we can't do that all the time. We're a $500,000 operation. Where are we going to send these people to get their prescriptions filled? We send them to Oak Forest. Who else is going to do it? These are vital medications. And so if the emergency room, they have to go to the emergency room, see a doctor, get a new script because they won't honor the one from that hospital or this hospital. If they can't go to Oak Forest, where are they going to go? Before you shut this emergency room down, we need to know where we're going to refer our people to. We can't fill all these meds. It's just not possible. And so before this emergency room is shut down, we need to know, respond. I need that answer. Where are we referring people to get their prescriptions filled? Thank you.
Thank you.
Next speaker is George Blake.